Hello, everyone. My name is Petros Benassi. I am a faculty member here at Kaplan, and I'm joined by three of my colleagues, Nzinga, Ari, and Henry, who are going to join me in a conversation to talk about what it's like to be preparing for these very, very important entrance exams, and especially some advice on how to be preparing right now. In 2020, with everything that's going on, with all the changes that are going on, with a constant kind of shift in how we're learning and what's just the news of the world and the ever evolving news of the world, kind of how can we keep some stability, how can we keep some focus, and more importantly, how we can really continue to adapt and evolve ourselves so that we can be the most successful in the application process and really in the testing process for these exams that we're all going to have to take. So with that said, we're going to treat this as kind of an informal conversation across the four of us, and really just to kind of pass along as much information as we can to you here today. So I'm going to open it up kind of with the big question of what advice specifically in 2020 would you have for a student who's preparing for what can be considered the most important exam of their life at this point. Obviously, there are going to be more important exams and bigger exams later down the line. But what would you say to a student kind of right now as we're thinking about the application process and thinking about the test preparation process? So, Nzinga, I'm going to start it off with you since you're in my upper left-hand corner of the screen.
So one of the major things I would say is to be patient with yourself and to be kind with yourself. There are a lot of things that are going to be constantly changing, and you definitely want to change with them. It's also a good idea to pay close attention to what's going on in your area, because that's going to be dictating what your experience is going to be like when it comes to test day. So I've had students who, because they were going to have to test with a mask on, that we had them practice with a mask on, right? We had them practice with an N95 mask on. And a lot of them were saying, man, that thing is uncomfortable. We have to get used to sitting there for however many hours that is with whatever PPE that we're going to have to wear. So I'd say definitely stay on top of what the requirements are for your particular exam. And a great way to do that, a lot of the organizations that put out the exams, they have Twitter accounts. So a really, really great way to do that is to go on Twitter, follow them on Twitter. You don't need a Twitter account to watch and see what they're saying, but make sure that you're updated so that you can govern yourself accordingly, starting from your practice all the way up until test day.
And that's just good advice in general, right? I mean, regardless of a pandemic happening, obviously there's some additional layers of kind of practice we have to incorporate, but practicing the way you're going to play is always kind of great advice in general. So even if we're somebody here who's watching is testing 2-3 years from now and they're not going to have to be wearing a mask, still very important, hopefully not having to wear a mask, still very important to always be kind of even taking practice tests or doing your studying in a similar environment to how you're going to be testing. Something that we oftentimes do speak to our students about. And Nzinga, you brought up a great point that I just wanted to elaborate on for a second, and that was the locality. We definitely, looking at kind of how things have been evolving, it is a very, very kind of local or locally mandated rules, and really important to kind of be up to date on what those things are, because these are exams that are administered nationwide, worldwide, and there are different rules in place in different places. I mean, we even saw this over the summer where certain testing centers were open, certain testing centers ended up having to get canceled. So students that were in those centers were affected, but the students that were in the ones that were, remained open didn't have that to occur. I'm going to kind of continue. So Ari, we'll go to you next.
Sure. I think one thing that you want to make clear more now, I think even than ever, especially amongst unchanging, uncertain kind of conditions, is to make sure that you have a plan in place. Now, like, it's important to recognize that the plan shouldn't be set in stone, that like not all is lost if, like, let's say somebody you got sick, or somebody in your family got sick, and you got to help, like, kind of put things aside and take care of them. That your plan should be able to accommodate for any, you know, changing characteristics. So you want like a structure to be set, but you want to be able to adapt and go with the flow as things happen. Without that structure, I think it's really hard to project towards like timelines and goals, and to hit like markers, and to make sure that you know that you're on track for, you know, whatever standardized test you're prepping. So like, you can't just like throw caution to the wind and study for a lot of these standardized tests, you know, kind of like how you would for one of your, you know, one of your classes, you know, that whole like cram the night or the couple of nights before. It's not going to work out. It's just too much. It's too big of a test. It's really important. So you want to make sure that you are dedicating that time and effort, and to set aside some time to plan out, to arrange your schedule so that you have that time and space to be able to test for it, but to build in a little bit of flexibility. One very practical piece of advice I've been telling my students is to budget in a catch-up day, like a block where you don't actually assign anything specific in it, but it's like your catch-all. Like, if I had things that were busy earlier this week, that's okay. I've got my catch-up block near the end of the week, and I can kind of overflow into that and make things work.
Yeah, I think it's part of the plan is to have a backup plan in a way, right? And to have that flexibility, and to just, you know, be amenable to the changes that might be thrown your way. One thing that we saw very early on, and I think this is true for a lot of pre-health students, and you can agree or disagree with me as I state this, pre-health students generally are good planners, right? I mean, have thought about things longer term, and then all of a sudden this past spring, all those plans just, you know, disappeared, because it was, wait a minute, I was supposed to use the MCAT as an example. I was supposed to test in April. Now I can't test. What is that going to mean? So obviously there was a little bit of a shakeup, to say the least. But, you know, the students that were able to make those adjustments and really just understand that, hey, this is something that's affecting everyone, you know, definitely had kind of the benefit of moving forward and looking at the alternates that are there. Speaking of kind of having that flexibility, Henry, you're in a unique situation across the four of us, in that you actually have taken an exam this year in the times of COVID, and you know, so with that kind of coupled, I mean, we'd love to hear kind of what that experience was like, and of course, what advice you have to students specifically, both as, you know, an MCAT teacher, but also as somebody who has tested recently. So take it away.
So the first thing I think I would say is I can understand everyone's frustration right now if you are trying to prepare for something, and you feel like you're getting yourself into a good position, and then suddenly things change. I think what Nzinga and Ari have said are spot on, and you need to be good to yourself, and you need to be flexible. When I was prepping for my exam, was supposed to be April 9th, and in March, I remember my classmates saying, well, what are we going to do if they close, you know, the testing sites? And I said, don't worry about it. It's not going to happen. We're taking it in April. We'll be fine. And then within 2 weeks, the sites had started closing around the United States. And within 3 weeks, our sites had closed. And so I rescheduled for the end of April, and then that wasn't going to happen. And then I rescheduled for the start of May in another state, and then that wasn't going to happen. And then I reached a point where I said to myself, you know, there's only so much you can really do right now, and you can't keep grinding down. You've been at this for so long, you're starting to burn out. And I needed to be flexible and say, okay, can I readjust my plan? Now, notice that's not getting rid of your plan, right? It's just having that internal clock of how much I can handle, and then understanding that sometimes you're going to have to move things. And so I did. I pushed it to the end of summer, and my school was very gracious as to, you know, be accommodating with that. And most folks right now will be accommodating. So don't hesitate to reach out for people around you, your schools that you're in, what have you, for support. People understand right now that everyone needs flexibility. And then, you know, understanding that your backup plan may end up requiring a backup plan, but all of this right now is normal for everyone. And even though it's difficult to adapt to, and even though it's frustrating, it's the fact of where we are right now. So luckily, they are still standardized exams. They're not going to terribly change what they're throwing at you. The timing may change, but for the most part, your prep can remain the same. It's a matter of keeping cool, keeping calm, and understanding that, by the way, since you're going into the health professions, this flexibility is what you'll need on a day-to-day basis anyway. So you're developing a great skill from now. So be patient, be calm, continue to, do your best, but take those days to also reset, be well in touch with yourself, keep the people who know you best around you in the loop so that you're making good decisions, and understand that for whatever reason right now, all of our plans are getting adjusted here and there, and that's okay. As long as you are taking care of yourself and moving through this, it will work out fine in the end, and you'll continue on your path. The rest of the world is still moving forward, even if it looks a little, obscure and lined with obstacles. It's still moving forward.
Right. And Henry, I didn't mean to interrupt you earlier, but which exam was it that you were testing or taking?
So I had the pleasure of USMLE Step 1. I won't go any further than that. I'm glad it's behind me.
Right. The reason, you think the MCAT or the DAT or any of the exams are hard. The USMLE Step 1 is harder than all of them, and it's it's an 8-hour exam. It's a big one, obviously. So congratulations on finishing that, and glad everything worked out. Right. That's the reality, is that it will all work out. It might not work out in that kind of perfect plan or perfect timing that one may have originally intended for it to be. So, I think this is 3 great perspectives, right? Just kind of, and really the one unifying theme I'm hearing in all this is flexibility. And we've touched upon that. I think each of you have touched upon that, and it's just so important. And I've heard that from colleagues in the health professions. I've heard it from, physicians. I've heard it from my dentist. I had to go in for what was supposed to be my 6-month cleaning, and it ended up being like a 12-month cleaning because I was scheduled right before everything, started to happen. And it was like, you just got to be flexible. You got to make things work as they are. That being said, we talked about COVID. Let's just talk about test prep in general. These are important exams, right? And these are exams that are a significant part of the application process. They're not the only part of the application process. In general, your grades, of course, will be looked at. Of course, your life experiences, personal statements, volunteer work, all those kind of subjective areas that make you who you are. But we also know that the entrance exams are an important part of the application, namely because they do serve as another tool, a standardized tool, right? A tool that is, everybody is being measured against the same standard, hence the term standardized exam, and an exam that will predict how well a student, or likelihood that a student will do well in the upcoming health professional school. So, in general, regardless of COVID, there's a lot to kind of be considering as you start thinking about how to best maximize your scores. And I'll start the bidding by saying, one thing that we oftentimes see with students, and I'd love to kind of get a conversation going around this, and we kind of touched upon this. I think, Ari, you mentioned this as far as studying for undergraduate exams and cramming for those undergraduate exams, or even high school exams for those of you that are in high school. You can't do that with these exams, because these exams aren't just testing you on content. They're testing you on content. They're testing you on critical reasoning. They're testing you on your ability to actually execute the material in the amount of time that they are prescribing you for the task. So, kind of advice number 1 really is, don't study for these exams the same way that you would study for kind of all your other exams, right? These are exams that are going to incorporate lots of practice. These are exams that are going to incorporate content review, but more importantly, the application of that content. Specifically, you look at kind of how you're rewarded on these exams. It's all about how well you're able to apply that content. So let's open it up. Let's have a conversation. We're four sciencey pre-health teachers in a room. What else do we say to people who are kind of in that starting process of getting ready for these exams?
I'll kick it off. I will say that the number 1 thing that I've seen across exams, and I'm sure all of you have seen it also, is that we tend to underestimate how much time it's going to take us to study. And that is the number one piece of advice that I would give anyone who's going to sit down and study for a standardized exam, is to literally carve time in your schedule for it. So depending upon what the exam is, how far away you are from your desired score is going to dictate how much time you need to spend. But regardless, time is going to be of the essence. So I've seen a lot of students who will be on the volleyball team, who will be in the drama club, who will be volunteering after school and trying to fit in the course amidst all of that. And sometimes when it comes to sitting down to study for these standardized exams, you have to make sure that you deliberately carve out the time, and that it can't be just another thing that, oh, I'm only going to do this once a week and then that'll be it. That's not going to be the key towards getting test day success. I know with a lot of students in college, there's a lot going on. Well, maybe they're going to be volunteering in a lab. Well, maybe they're going to be doing research in the lab. You know, maybe they're the head of this club. Maybe they're taking a really heavy course load. And especially when it comes to exam like the MCAT, you kind of want to treat that like a part-time job. So you want to have at least a good 10 to 15 hours per week in order to make sure that you can dedicate that to studying for the MCAT. So time, plan holes in your schedule that you can fill with preparation for your exam. That's going to be number one.
Perfect. Right. I mean, that's exactly it. Planning and time. Henry?
Sure, I'll chip in. I think one thing I see with students who are initially approaching studying for a big standardized test is that they consider the test to be the barriers to their dream. They'll be like, I have all the things in place. I've got my application, it's beautiful, my GPA is great. The only thing in my way is getting a good score on this test. And I think one thing about getting good at standardized tests, and I hear this a lot, oh, I get a lot of anxiety. I'm bad at standardized tests. I'm like, I think perspective is really important, that you shouldn't really be seeing these tests as like the barrier to your dreams, but more like, in order to do well on this test, you are training to be the kind of thinker that these schools are looking for. So to do well on the MCAT, you want to learn how to think and solve problems, right? They're not asking you, like everyone's got a computer, they got phones, they could Google anything, right? We're not looking for people who can like regurgitate facts. We got things that do that really well already. But it's really hard to know how to solve problems, to be able to synthesize information from, you know, a piece of text, from your content background, from like all sorts of different sources of information to then come to an answer. And that's really important. That's a life skill, right? So don't think about these tests as, you know, bad things, right? These are all just training programs to get you into the right frame of mind to be successful in your future profession.
Yeah, oftentimes students, when I speak to students and they're frustrated, I say to them, you're not studying for these exams to do well in the exam per se. You're studying for these exams to do well in the exam so you can show your, not, I mean, as you said, your potential, this obstacle, so that you can go be wearing the white coat, right? I mean, that's the goal, right? Is to be in that, you know, to be wearing the white coat at the end of the day. So absolutely love it. Henry, any thoughts?
Sure. I think what I would contribute is that for standardized tests, one of the best tricks I've learned along the way, not even tricks, just one of the best skills I think you need to develop along the way, is to take the time to actually do practice and learn how the test is going to test you and how it's going to ask you questions. A lot of times what they'll do, you know, they're testing the same concepts over and over, but if they just come out and ask them the same way over and over, then it just becomes kind of mind-numbingly easy to take the test. And so they like to try to keep it challenging. And so an example I'll give is I was doing practice questions. So this is not from the real thing, but I was doing practice questions for like USMLE, and they were talking about this inherited condition with the eye. And part of the history they give you is, you know, that their parent died in a car accident. And you have to understand that what they're telling you is the parent had it too. Now, realistically, in the context of taking a patient history, I never would have said, oh, your father died in a car accident. Very obviously, he must have had the same genetic condition. But in the context of the way they test you, they're giving you these hints and they're trying to portray things a certain way. And you can only learn that. You can only learn that by practicing their questions and then reviewing them and seeing what you did well, what you didn't do well, what hints you caught, which ones you didn't catch. And that's something that exists kind of in a separate bubble from the content side of it. So you can learn everything that's in the books, but if you don't learn that part of it, there's always going to be that part of the test that you struggle with. And so I think regardless of what test you're taking, regardless of what stage you are in your prep, that's something that's beneficial to have some focus on at some point during your prep, because that, I think, in my experience, has been the great equalizer, is learning how they're approaching it and learning how they want you to think about it and picking up on their hints. And then that makes things a lot easier.
Absolutely. Such great advice, and I will now disclose everything to my doctor when asked, right? Because maybe there's some information that that I didn't think about that would be relevant to them in making a diagnosis. That being said, I wanted to take this opportunity to really say to everybody who's watching, these are exams that are totally conquerable, and I think we will all agree with that statement. These are exams that are preparable. There's no mystery to them. It's not like some secret, safe that has all the information of what's going to be tested. Like the information as far as what is being tested on these exams is out there. And there are lots of free resources, lots of ways to get started. I mean, we have plenty. So, visit our website, come to some of our events. I mean, use us as a resource, because that's what we're here for. I mean, we are all in these roles because we love doing what it is that we do, and that is helping students achieve their dreams and overcome those obstacles and really get to the next stage in their professions. So, Nzinga, Ari, and Henry, thank you for doing this and for sharing your advice, imparting your wisdom. I know you're all very, very busy. They all have lots of students to get back to, so we'll leave it there. And to everybody who's participating in Health Professions Week, Kaplan has been a proud sponsor for a number of years, and we look forward to continuing that relationship and really supporting you as students as you go through your pre-health journey. So have a great rest of your day, and thanks again for joining us.